Thank you to everyone for joining us for today's webinar. I'd like to thank the funders of Cochrane Canada, without whom these webinars, our training, systematic reviews, and capacity building could not happen. Thank you as well to CIHR for their support. I'd also like to thank PAHO for kindly providing the software for our webinars. And a special thank you to Louis-Gabriel Cuervo, who produces videos of our webinars, which are located on the Canadian Cochrane Center's webinar archives. Without further ado, I'd like to introduce today's webinar on the Cochrane question, presented by Jennifer O'Neill, who is the coordinator of the Campbell and Cochrane Equity Methods Group. Jennifer has been an author with the Cochrane collaboration since 2008. In her role as coordinator of the Equity Methods Group, she provides Campbell and Cochrane systematic review authors with guidance on methods for equity-focused systematic reviews. She has a master's degree in public health from Simon Fraser University and is currently a PhD student at the University of Split in Croatia. Jennifer joined the Equity Methods Group as a coordinator in October 2011. I'd like to thank you very much, Jennifer, for being with us today. Now please go ahead.
Okay, hi everybody. Can you hear me? Is all okay? Okay. So the topic for today is starting at the very beginning of your review, and it's going to focus on getting the question right. So this slide shows you the steps of the Cochrane Review. We're going to start right at the top in defining the question. So for a Cochrane Review, you start with formulating your question and then registering that proposed question in the format of a review title with the relevant Cochrane Review group, and that helps us keep track of which reviews are currently in progress. And then you'll plan your eligibility criteria and methods in advance, and these get published in the Cochrane Library as a protocol. And then once your protocol is published, you can proceed with running the review. So in this webinar, we're right at the beginning just talking about developing your question, and we'll get a little bit into the write-up of your protocol. So first, overview of review questions. Then we'll cover the components of a review question, and then what you'll include in the protocol. So there are a few types of questions that you would include in a Cochrane Review, and then there are some questions that aren't relevant for Cochrane Reviews. So Cochrane Reviews do not deal with questions of incidence, prevalence, or association, but questions of intervention efficacy, intervention effectiveness, diagnostic test accuracy, prognosis, and methodology would be considered for Cochrane Reviews. For today's webinar, we're going to focus on Cochrane intervention reviews. So that's reviews that focus on addressing questions of intervention effectiveness or intervention efficacy. The titles for intervention reviews have a standard format, and they look like intervention for a health problem. So we'll come back to the title later, but here's a few examples. So Cochrane intervention reviews would have titles like antibiotics for acute bronchitis or community-wide interventions for increasing physical activity. So defining your question. A well-defined Cochrane question is really essential to your review. It's really important that you're clear about what your review is going to cover right up front, as the question is going to define the subsequent steps of your review, as well as some of the decisions that you're going to make at each of these steps along the way. So your review question is going to determine the eligibility criteria, so what studies are going to be included or excluded from your review. It's going to determine how you'll develop your search strategy and what kinds of studies you're going to find. So if your question isn't really clear, you might miss studies that would be really of interest to you, or you might get a lot of papers that aren't really relevant, and it's going to increase the screening time that's required to complete your review. Your question will also determine your analysis of the results of your studies. So it's going to determine what outcomes you want to measure and whether there are any other specific issues you want to explore. So it helps you determine what data you need to extract from the included studies. So it's really worth spending some time at the beginning to think this through in a lot of detail. It's going to help you plan your work, because you'll have a clear idea of the scope of your review, and that will help you avoid bias later on. So by laying down the parameters in advance, you'll reduce the risk of making decisions or changing your mind later on the fly in a way that might be influenced by the results of some of the included studies. So when you're registering your title, your question will be discussed and agreed with the Cochrane Review Group. So it is possible to make changes to the scope of your review later on, but you will have to have a discussion with the Cochrane Review group and get some agreement if you plan to do so. Okay, so planning the topic and the scope of your review. So you want to take some time to think about the importance of your question. So who is your question relevant to? Does it address an important burden of disease? And what is the possible impact of your intervention on that burden? So you want to try to select a question that has real importance to the people who would be affected by the intervention. So not only the consumers and health professionals, but also policymakers that might be making decisions about whether to implement programs based on this intervention. You also want to make sure that the question that you select addresses real choices that a person has to make in decision making. So you want to consider the intervention options that are actually available and what are the outcomes that would influence those choices. So for example, if you're thinking about doing a review that looks at a new intervention, would it be most useful to include studies that test that intervention against no intervention or a placebo? Or would it be more useful to test it against currently available treatment options? And then finally, Cochrane Reviews should also consider an international perspective. So the burden of disease might be different from one country to another or among different populations. And the intervention options that are available or the way the health system operates could also be different. So you want to make sure that your review is relevant to people anywhere in the world in contexts that might be very different from yours. So try not to make too many assumptions when planning or interpreting the results of your review. So one of the issues that comes up when you're thinking through your question is whether you want to go broad or narrow in the scope. So if you want to consider a narrow question, for example, looking at one specific intervention in a specific patient group, or do you want to consider looking at all the interventions to address a particular health condition? There are pros and cons to both types of questions, but a well-developed systematic review question will be broad enough to answer a useful question, allowing for some variations that will be observed in the field, but not so broad that it doesn't make sense to consider all of those interventions, all of those studies together in one review. So narrower questions may make the review easier to write and easier for the user to read, but a user might need to read multiple reviews to answer all the questions that relate to that condition or that intervention. And broad reviews are more comprehensive, but they could be more complex and difficult for authors to write and can miss some of the detail that would be possible with a narrower review. In some cases, what's most appropriate can change over time. There was once a Cochrane review called Interventions for Shoulder Pain, and this looked at all the possible interventions like steroid injections, physiotherapy, exercise, and painkillers to address shoulder pain. But over time, more and more studies were published that addressed each of those interventions, and it became unmanageable. It was too difficult for the authors to include all the different interventions in one review, but it was also too hard for the reader to follow. So that review has been split into a set of reviews that look at one of those specific interventions. And one way that Cochrane manages sets of narrow reviews is to publish something called an overview of reviews. So these are papers that summarize the findings of multiple related reviews. And if you're interested in overviews, more information is available in the Cochrane Handbook in Chapter 22. So regarding broad or narrow questions, there's really no right or wrong answer. It's going to depend on what you're interested in. And it also will depend on what the review group prefers. So they might have a preference for broad or narrow based on their previous experience, or based on how your review and your question fits in with other reviews that have already been published with their group. Okay, so the next section will discuss the components of a review question. So you've probably seen the PICO format before, and if we were in person, I'd get you to raise your hand, but since we aren't, I'm just going to assume you've probably seen PICO, because it's used for lots of different research. So primary research, literature reviews, use PICO, and we also use it when we're thinking through the question for a systematic review. So PICO stands for Population, Intervention, Comparison and Control, and Outcomes. And when you're thinking through your question, you're going to have to define each of these PICO aspects very clearly. So you want to define who are you interested in studying, what's the intervention that you want to test, what will you be comparing that intervention to, and what outcomes will tell you whether or not that intervention is effective. And within each component, it's also important to think about the variations that you might like to explore further, such as whether there are certain subgroups of the population for whom the intervention might work differently, or variations on the way the intervention could be applied. And you're going to use the PICO to help define your review's eligibility criteria, so whether or not you include or exclude studies. So let's take a look first at the population. So sometimes population would also be called participants or people. But the main thing here is to consider what are the most important characteristics that describe the people you're interested in. So the level of precision that you need when defining your population will depend on the topic of your review, so it should always be described in enough detail that it's really clear to the reader which studies you wish to exclude and which you wish to include. And you want it to be really clear to you and your whole author team so that everybody can decide the same on one study. So everybody's going to see the study and understand whether or not that population was an include or an exclude. So for example, if you're interested in a specific population with a defined diagnostic criteria, like for example, a particular stage of breast cancer, then you want to make sure that you've described that criteria in enough detail that everybody can make the same decision. But if you're looking at a broader group of people with a health condition or no health condition, like any stage of breast cancer or a healthy population with no health conditions, then you probably don't need to describe it in as much detail. But whatever limit you place around the group of people should have a clear rationale. So if you limit, for example, to a specific stage of disease, then you'll want to explain why. Is it because you expect that this group would react differently to an intervention than other people? The most important thing is just to be really clear in why you've made that decision. So when defining your population, you'll also want to think about what you'll do when you come across studies in which only some of the participants actually meet your eligibility criteria. So sometimes a study might have some eligible participants, but some ineligible participants. So if you use an age cutoff, for example. So what you need to think about is how you're going to apply your eligibility criteria. Will you include or exclude this study? So there are a few options that you can think through. You could either include the whole study, although this might mean that you'll have some participants who don't meet your criteria being included in the review. It also means you won't lose the information about those participants who did meet your criteria. So you might wish to select a threshold or a cutoff point for this. So you could decide, for example, to include any study that has at least half of the participants or at least 80% of the participants meeting your criteria. Another option would be to decide to include only the information on those participants who meet your criteria. This ensures that you don't have any information from ineligible participants, but detailed information on the participants that do meet your criteria and separate results for them might not be available in the study as published. You could always try contacting the authors for separate information for the population you're interested in, but just remember you might not be able to get that data. And then finally, you could decide to exclude the whole study. So you'd be deciding then that the risk of including some information from ineligible participants outweighs the benefit of including the study at all. If possible, it's good to specify in your protocol how you're going to manage these types of situations, especially if you know that it's likely that there will be mixed population studies in your field. And then, like I said before, a rationale should be provided for why you've chosen one approach over another. And remember that it's not always possible to predict these types of situations ahead of time, and in some cases you might need to make some post hoc decisions once you've included the study. And the thing to remember here is you should keep the overall aims and rationale of your review in mind, and then you should document any of the decisions that you make so that you can include them in your full review. Okay, so the next part of a population is equity and special populations. So as I mentioned before, Cochrane Reviews seek to be relevant internationally and across different contexts. So it's important to consider your question in relation to all the different types of people who might be affected. So depending on your question, you might need to plan additional methods in your review to ensure that these questions are addressed. So you might want to consider whether the intervention might have different effects depending on the factors of the acronym PROGRESS+. So PROGRESS stands for place of residence, race, ethnicity, culture, and language, occupation, gender and sex, religion, education, socioeconomic status, social capital, and then plus captures any other characteristics that could be associated with discrimination, such as age and sexual orientation. So why would you want to consider these? Depending on your population, there could be difference in prevalence and progress of disease. So for example, antibiotics for sore throat might not be a useful intervention in high-income settings, where the impact of the disease is not great, but in some low-income settings, there is a greater likelihood of progression to rheumatic fever, and that means that there could be serious consequences such that you might come to a different conclusion about whether or not antibiotics for sore throat is an important intervention. There could be different effects or safety. So for example, some interventions might work differently in different cultural settings, or there could be biological differences in the way the intervention works among different ethnic groups, in women compared to men, or in children compared to adults. And there could be different outcomes of importance. So for example, interventions in children, you might be interested in studying the attendance at school, but that wouldn't really be relevant for adults. Or you might need to measure the outcomes differently depending on your population. So for example, you would measure pain in newborn babies differently than you might measure pain in adults. And the cost of an intervention could also be important for people who don't have health insurance or for policymakers who are planning to implement this intervention in resource-poor settings. And one other different outcome would be the duration of treatment required. So participants in rural settings might need shorter durations because they will have to travel long distances to access treatment. So although these types of issues wouldn't form your eligibility criteria, they will help you consider other aspects of your question as you plan your review. And the Equity Methods group, for which I'm the coordinator, can help provide you with guidance and resources if you are considering equity in your review. So I've put our website at the bottom of this slide, and you can feel free to contact me if you have any questions specific to equity in your review. Okay, so here are some examples of the different types of interventions that you might consider in your review. And as you can see, there's lots. So what we thought we'd do here is give you the chance to brainstorm by typing in the chat what factors you think might affect the effectiveness of your intervention. So I'm going to ask everybody to write a few, or at least one factor that you think could affect your intervention and its effectiveness. Time and cost, other confounders are a few that are coming through the chat. Blinding, season of year, dosage, cost effectiveness, toxicity, side effects, underweight, overweight. They're great things coming through. The heterogeneity of the population, other interventions, safety issues. It's great. Okay, so I will show you the list that's been provided by Cochrane. So here are some of the intervention details to think about. Intensity, delivery, the timing to frequency and duration of the intervention, equipment, personnel, location and context, and whether the intervention is provided alone or in combination. So whatever you decide that your intervention is going to be, you have to describe it in enough detail that you can distinguish your intervention from those that fall outside the scope of your review. So if you're looking at a very specific topic, like a specific dose of a specific drug, then you can be really narrow in your definition. But if you're looking at something more complex or multi-component interventions, then you can be less detailed in your criteria to allow for expected variations in the literature. However, you must be able to clearly identify which are the core or common factors that determine whether each study or each intervention or each variation of the intervention falls within your review or is so different that it should be excluded. So based on the objective of your question, you'll want to think carefully about the advantages and disadvantages of including your study, or including studies that test your intervention in combination with other interventions. So if you're interested in the direct effects of something like physiotherapy for shoulder pain, then you wouldn't want to include studies that look at physiotherapy in combination with something else, like, for example, painkillers, because that's not going to address the question that you're interested in. But if you're looking at physiotherapy, multi-component interventions, then you might include studies that look at physiotherapy plus something else, so physiotherapy and painkillers. And when you're doing complex interventions, it's really important to be really clear and informative when you're describing the components of your intervention. So it's something like rehabilitation programs or behavioral interventions or community-based interventions. You want to be really careful because these are really often poorly described in the literature, so it makes it harder for you to make decisions about whether or not it's going to be included. So if you want to think it through ahead of time so that you can be clear about what aspects of those interventions will meet your criteria and which would not. And then you want to be clear when you describe it in your review because that's going to help the users of the review actually implement the intervention if you find it to be effective. Okay, so again, it's important to consider your intervention and how it might be applied in different contexts or internationally. And some of the factors that you might want to consider is whether your intervention is actually available in every context, or does it depend on certain specialized equipment that might not be available everywhere? Are there specific skills, or is there specific training that the staff implementing the intervention will need? And will different staff be implementing the intervention in different settings? Is the intervention acceptable in all cultural contexts, and will it work in approximately the same way? Is the intervention affordable to people with different incomes or with different insurance systems? And it's really important that you think these through ahead of time. Okay. So now we're on to the comparison or the control. So what you want to think about here is what types of comparisons are you going to include in your review? These should be clearly stated based on the objective of your review question. So if your review is comparing the intervention against a specific active alternative or more than one active alternative, for example, you're comparing one drug versus another drug, or health professional-led interventions versus peer-led interventions, then you want to make sure that you describe those comparisons in as much detail as you've described the intervention. But if you're comparing the intervention against any alternative or against no intervention at all, then you might not need to be as specific in your eligibility criteria. For example, if you're comparing caffeine to any alternative intervention. And even if your objective is to test your intervention against no intervention, remember that there can really be some differences between inactive comparisons. So there's differences between really doing nothing, or using a placebo, or using usual care. So you just want to make sure you've thought about that. And also remember that usual care can vary from one study to another. So you might want to plan to examine the differences in usual care carefully if that applies to your review. And again, remember to consider the real choices that are available to people making decisions in this area. So what are the options that are currently available? Have some options become obsolete, and maybe you wouldn't want to include those in your study, in your review. And finally, if your review is broad, you can choose to include studies that compare your intervention to any possible comparison. And if that's the case, you just want to make sure that you state that clearly, that any possible comparison was eligible. Okay, outcomes. So outcomes are not always expected to be part of your eligibility criteria. And commonly, studies that do not measure your outcome of interest could still be included in the review and written about in your review, even if they don't contribute to the analysis of those outcomes. So it's important to include these studies because that helps you present a complete picture of the literature. So you're probably familiar with the concept of publication bias, and that's that studies with positive or significant findings are more likely to be published than non-significant studies. But that also applies within studies to the reporting of results for individual outcomes. So those outcomes with positive or significant findings are more likely to be fully reported in a paper, which means they're more available to be included in your review. So it's important to consider the possibility that the outcome that you're interested in may have actually been measured in the study, even if they weren't reported. And by excluding those studies without exploring this further, you run the risk of introducing bias to your review. And don't forget, you can always contact the authors of a study to obtain additional information for them. In some cases, though, it is appropriate to include the outcome in your eligibility criteria. So for example, if your review is addressing a question of prevention, then you probably want to make sure the studies that you include have outcomes for prevention and not just treatment outcomes. And then for interventions that have many applications, you might want to define your review to cover one specific field. So for example, in the Cochrane Library, there are currently separate reviews that look at hormone replacement therapy for menopausal symptoms, for cardiovascular outcomes, and for cognitive outcomes. So whether your outcomes are going to form part of your eligibility criteria or not just needs to clearly be stated in your protocol. So a little bit more about outcomes. Even if they aren't part of your eligibility criteria, you should identify the outcomes that you plan to assess in your review at the protocol stage. You want to plan to report on outcomes that are important to people who are actually making these decisions about the intervention, not just the people affected by the condition, but also the people making decisions about care. And it's important that you plan in advance which outcomes you're going to report to minimize bias in the selection of outcomes when you come to complete the review. And then don't forget that in Cochrane Reviews, we always want to include any possible adverse effects as an outcome. So you might want to consider how outcomes are measured. So are there published and validated measurement instruments for your outcomes? You might want to consider the variety of ways in which an outcome can be measured and reported, and only be restricted if you have a good rationale. For example, if the latest validated test is the best, but it's only released last year and it might not be widely adopted, and it might mean that you exclude a lot of studies. You might also want to specify important time points for the measurement of outcomes. For example, if you're looking at interventions to improve bone density, you need a longer follow-up than a few weeks. So you might want to consider what the minimum period of time is where you could expect the intervention to have an effect, and think that through when you're planning your outcomes. And it's also important to select your outcomes based on the information that you think is actually important, not just on the information that you think you're going to be able to find in the literature. So for example, if you're interested in mortality, you want to include it as an outcome, even if it's really unlikely that studies are going to measure it because they're shorter-term studies and the mortality is a longer-term outcome. Short-term surrogate outcomes like biochemical markers might be easier to measure, but they don't always correspond to the longer-term outcomes in the way that you expect. And process outcomes should be used with caution. So these are ones that report on the way that an intervention is implemented rather than its outcomes. But process outcomes are actually important to health professionals and policymakers in determining whether this intervention is feasible for them. So process outcomes are also good, but maybe interpret them with caution. And finally, the last slide on outcomes is that you might want to consider looking for core sets of outcomes for your field. So certain fields like rheumatology have core sets of outcomes, and these are agreed sets by researchers of outcomes that they plan to measure across all the studies on that particular area. So in rheumatology, it's the Outcome Measures in Rheumatology Trials Initiative, OMERACT, and they meet every couple of years and they vote on which are the outcomes that are most important to be measured in the different areas of rheumatology. But if your field doesn't have an agreed set of measures, you might want to think about or look up what other outcomes have been reported on reviews of similar topics. Something else you might want to consider is that your included studies could report multiple similar outcomes, and that leaves you with a choice of what you're going to report in your review. So for example, a study could report outcomes at 2, 4, and 6 weeks. All of these are unique, or you want to consider whether all of those are unique and useful measurements, or whether you want to select one of those to represent short-term effects for that study. And then some studies might use several similar measurements, such as different tests for range of motion or different measures of overweight, like weight, BMI, and waist circumference. You want to have thought through ahead of time what you're going to do with this possibility so that you can avoid making selective decisions later on, such as choosing whichever measure is going to give you the largest significant effect. So principles that you can use to help make these sort of decisions are things we've mentioned already. So are there some outcomes that would be more meaningful than others? Are some outcomes more commonly used across the literature? If these principles don't help you, you might want to give yourself a method of choosing a representative outcome that avoids selectivity, such as choosing the outcome with the median effect size of the group. Finally, you will be expected to report on all your planned outcomes in your final review, even if you don't find any studies that measure that outcome. Picking and choosing outcomes based on those with good available data can introduce bias, and reporting the outcomes of importance that have not adequately been measured is actually a useful finding for people who are reading your review. Okay, so prioritizing outcomes. You'll need to determine which outcomes are going to be your primary outcomes. Usually there's a max of 3 primary outcomes, and these are the outcomes that are going to form the basis of the conclusions of your review, and these should include at least one potential harm. Then you'll want to choose your secondary outcomes. And keep in mind that the total number of outcomes to be addressed should be kept as small as is reasonable for your question, and should focus on outcomes that are actually important for decision makers. It's important to prioritize your outcomes to help you report the results of your review, particularly when it comes to summarizing your results. Cochrane Reviews have a range of short formats to help summarize results, such as the abstract, the plain language summary, or something called the summary findings table of your review. So you may not get to report all your primary and secondary outcomes in each of these summaries. So we recommend that you identify a group of outcomes, including your primary outcomes and a few of your secondary outcomes that can be designated as your main outcomes. So your main outcomes are those that are most important for decision making, whether or not you expect to find enough data in the literature. And you should also try not to duplicate within your main outcome. So you won't want to have multiple variations of the same outcome. So like I mentioned before, you don't want to have weight and BMI included in your main outcomes, or measures the same outcome at different time points. Unless there is a clear rationale, additional variations in time points can be included among your other secondary outcomes. Okay, so at these planning stages of your review, it's appropriate to consider whether there are important outcomes that might incorporate some of these other types, so adverse effects, patient-reported outcomes, equity, economics, or qualitative. So, or you might wish to incorporate specialized outcome types such as economic or qualitative evidence. Consideration of these topics might require additional systematic literature searching and more advanced analysis methods. And within the Cochrane collaboration, there are methods groups that address each of these topics, and information is available in the handbook. You can contact the coordinators of each of these groups by getting their information from this website that's provided on the slide, Methods Groups, and the Methods Groups coordinators would be happy to help you think through some of these issues related to these special outcome types. Okay, so you might think that Cochrane Reviews only look at randomized trials, but actually Cochrane Reviews, while they mostly include RCTs, in some cases we do include other study designs. So we always aim to include the most appropriate study design to answer the review question. For straightforward questions about the effects of interventions, that's most often RCTs, and methodological research tells us that RCTs are the best way to avoid bias. But if RCTs are feasible for your intervention, then they should always be included in your Cochrane review. Usually RCTs are the only design that you'll need to specify in your eligibility criteria, but you should always give rationale for the choice of any other study designs. So in some cases you might want to be specific about an aspect of study design that you specifically wish to exclude. For example, you might want to exclude any crossover trials from your review. Or in some cases, you might want to include quasi-randomized trials, so those with a method of allocation that are almost random but not quite, such as alternating allocation. Whatever you decide, you always want to give rationale for why you've chosen these study designs, and be clear. Okay, so now we're ready to turn our review question into a Cochrane title. So like I mentioned earlier, the Cochrane review titles are usually based on a standard format of intervention for health problem. But you might also include other details in your title, so based on your PICO elements. So some other examples might be inhaled nitric oxide for respiratory failure in preterm infants. So whatever you decide, you're going to discuss it with your Cochrane review group at the title registration stage, and they'll make sure that the title is appropriate for your question and for the reviews in their review group. Okay, so what do you want to include in your protocol? Your protocol has some standard sections, the background and the method. And there are several places in the protocol where details of your question will be explained. So in the background, you're going to give detailed descriptions about the condition of interest, including the burden of disease, the population, and how the condition affects people. And then in the method section, you're going to describe your eligibility criteria in the section called Criteria for Considering Studies for this Review. And then your list of outcomes to be reported is also included here, even if they're not part of your eligibility criteria. So when you've clearly defined your question and identified in detail the components we've just discussed, then you can define the eligibility criteria for your review. So these are the essential components or the boundaries that determine whether you're going to include or exclude a study. So remember that the eligibility criteria for your review might be different than the ideal criteria you would use if you were designing a primary study for yourself. For example, you might want to specifically look at the impact on people with a certain stage of disease, or you might have a preferred model for implementing a complex intervention. However, the body of studies that you find in the literature might show considerable variation from your ideal model, or could incorporate a mixture of participants with different stages of the disease. So if these studies are included in your eligibility criteria, you can explore the effect of these differences within the review. But if you rule them out, then they'll be excluded altogether and you won't have any of that data to consider. It's important to articulate each component carefully so that when you come to making decisions about including or excluding studies, that you can do so objectively as possible. And having clear criteria will help you avoid ad hoc decisions that could introduce bias. So following this pre-specified eligibility criteria is a fundamental attribute of systematic reviews. However, unanticipated issues could arise, and it is possible to have to make changes later on about your eligibility criteria if needed. Review authors are able to make sensible post-hoc decisions about exclusion of studies, so you should be careful to apply any new eligibility criteria consistently across all potentially eligible studies. So if you decide halfway through your screening that there's a new eligibility criteria that you hadn't considered, then you do need to go back to the beginning and apply that same rule across all the studies you've already looked at. And then to ensure transparency, any changes to your eligibility criteria should be reported in your final review and possibly accompanied by a sensitivity analysis. So that would be repeating your analysis to test whether your post-hoc decisions had any impact on the results of your review. Changes to the protocol have to be made on the basis, must not be made on the basis of the findings of the studies, because you don't want to introduce bias. So finally, the take-home message is that you want to think through the scope of your review in detail before you begin. You want to use PICO as a model. You want to use this PICO components to determine your eligibility criteria, and you want to be really clear and specific about those. And then this is also going to help you determine your search strategy, data collection, and analysis. The information in these slides came from this chapter of the Cochrane Handbook. And we'd like to acknowledge that the materials presented were prepared by the Australasian Cochrane Centre and the Canadian Cochrane Centre, and Miranda Compson, who's the training coordinator of the Cochrane collaboration. And now we can take some questions.
Thank you so much to Jennifer for presenting today. Let's all send Jennifer a round of applause by clicking on the applause emoticon. We have some questions here. Can you give examples of broad and narrow questions?
Sure. So a narrow question would be something like biologics for rheumatoid arthritis. So it's one specific drug for one specific health condition. But a broad question might be something like social media interventions to improve equity, or strategies to increase ownership and use of bed nets for malaria, things like that. Does that help answer your question? Any replies? No replies?
Okay, we'll go to the next question. Any recommendations as to how best assess the risk of bias in included studies, the Newcastle Ottawa SPL for observational studies?
Well, so there actually is a risk of bias methods group within Cochrane, and if you have specific questions about risk of bias for specific study designs, you could contact them. If you want, we can share the website address or the email address for the methods coordinator for the bias methods group.
Yeah, or they can even just, you can even email me. I'm just entering my email into the chat room, and then I will help liaise you guys over to the appropriate person.
Thanks. Okay, so I see one question is about that I mentioned not including weight and BMI as outcome measures. So it's not that weight and BMI are inappropriate outcome measures. It's just that if you don't want to necessarily include weight and BMI as your outcome measures, since unless you have a reason for why you need both. So some studies will have weight and BMI and waist circumference, or something like that. If you're choosing your main outcomes, you're not going to want to cover weight and BMI unless you have a reason for why you think that that's an important difference that a decision maker would need to consider.
Perfect. Another question. What is the difference between clinical trial and non-randomized trial?
Okay, so I'm not sure. Clinical trials, so randomized controlled trial would have a really specific method of randomization and a control group, and a non-randomized trial would have no randomization or not complete randomization. I'm not sure I totally answered that question, but I can definitely provide some more information about that. And in the Cochrane Handbook, we'll have lots of information about what we're meaning by the different study designs. I see a question that says, should the outcome from PICO be included in the eligibility criteria? Sometimes. It depends on your question. So a lot of times we encourage people to not include the outcome in their eligibility criteria just because, as I mentioned, the studies might actually have measured the outcome that you're interested in and just haven't reported on it. So you don't want to exclude it because then you miss the opportunity to get that information. But sometimes you're looking at a study where the outcome is important. I think the example I used earlier was if you're looking at interventions for prevention, then you'd want to have prevention outcomes versus treatment outcomes. So sometimes you want to use your outcomes in the eligibility criteria, but it's not always appropriate.
Perfect, thank you. And Pamela wants to know, what would you suggest on the following question: effects of cataract surgery on falls in the elderly in nursing homes?
I'm sorry, what's the question?
What do you think of the question, effects of cataract surgery on falls in the elderly in nursing homes? Would that be too broad? Is it on point?
No, I think the question sounds okay. There is a Cochrane Eyes and Vision group, and they will probably provide some feedback on what types of interventions that they would like to include. They might want to. They might have specific outcomes that they would want you to consider, because the effects of cataract surgery piece they might have some questions, but you would bring that up with the Cochrane Review group, the Eyes and Vision group.
Great. Now, how to decide what post-hoc changes in eligibility criteria should be reported in a review?
Well, you have to make the decisions on what post-hoc changes are appropriate as you make the decision. So sometimes there are things, like I mentioned, the mixed populations that you didn't consider beforehand, or you wouldn't have expected that a study might include certain groups of the population together. So you might have to make a decision after you've started screening on whether or not that study or part of that study would be included or not. And then that would be appropriate. But you don't want to change your outcomes. Like, for example, you don't want to decide to include an outcome you hadn't mentioned originally just because you're starting to find data on it that you weren't expecting. So that would be an inappropriate post-hoc decision.
Excellent. Now, for patient-relevant outcomes, do you need to have a consumer involved in the PICO?
It's always encouraged in the Cochrane collaboration to include consumers on the author team, and there's a consumers group that could help you find somebody, and there's a patient-reported methods group that could also help with that.
Great. Now, do you decide which databases to search before or after registering your protocol?
The databases you're going to search, you decide before you register your protocol. It might be while you're registering your title, and you can work with the review group and with the trial search coordinator to pick the databases. But when you write the protocol, you've already then defined which databases you're going to be searching.
Excellent. Now, there's a question here asking, if we need to incorporate the economic evidence into review, can we still pose review-based questions on PICOs, or should it be purely an economic question, like cost-effectiveness analysis of intervention A versus B?
Well, it still would sort of be a PICO. So I think you would still keep with PICO. Because that population, the P in PICO could be population, but it could be the problem as well.
Perfect. Are there any other questions that you would like to ask? Please send them in the chat room. All right, well, I think that is all for the questions for today, Jennifer. I'd like to thank everyone for joining us today. We really appreciate you coming to attend the webinar. I'd also like to thank Jennifer O'Neill for presenting. That was a fantastic presentation. Thank you so much. Thank you, and have a great day, everyone.